And, you know, for example, well, what I'll do is I'm going to read to you my initial submission of a definition, and then I'm going to, I'll just tell you a little bit about some of Ernesto Spinelli's comments, and then these panelists will talk with you about their comments. So let me just read this initial, if I can get this to work here, let me just read this initial definition that I submitted. That is an abstract, so we don't need that. You can see that I titled this chapter, by the way, Existential Therapy, Confronting Life's Ultimate Concerns. All right? And also, as you can see, I am a professor at Loyola Marymount University, and I am a clinical and forensic psychologist practicing in Los Angeles. And yeah, I would be happy to discuss also any kinds of questions about application of existential principles to the practice of forensic psychology as well. But primarily what I do is psychotherapy, individual psychotherapy with adults. Okay, so let me read this introduction to you. As a definition, my initial definition, existential psychotherapy is firmly rooted in a set of distinctive philosophical, theoretical, and methodological orientations to treatment. Now, right here, we started having disagreements about, for example, the use of the word treatment. Do we treat people in existential therapy? So it gets very, very complicated. From this basic conceptual framework, an increasingly heterogeneous collection of existentially based approaches has emerged, rendering contemporary existential therapy rather difficult. You see my editing, this is pre-publication, rather difficult to generically define. This chapter endeavors to distill from this presently disparate and diffuse field the existential, philosophical, and theoretical principles, core concerns, and clinical methods most characteristic of contemporary existential therapy. And I'm going to be talking about this throughout the day in different settings about what I call existential depth psychology. But that's sort of a somewhat different subject here. But it's important to remember that existential therapy has its roots in depth psychology, has its roots in Freud and Jung, and Otto Rank, and Alfred Adler. But also equally in existential philosophy, again, some would add in existential and phenomenological philosophy, for example, Heidegger, Husserl, Heidegger. Oh, look, and I cite Van Driesen's work. It is crucial to avoid confusing present-day existential therapy with the more morbid and pessimistic intonations of continental European existentialism. We're talking about Nietzsche to some extent, Sartre, Camus, Kafka. Contemporary existential psychotherapy certainly does seek to, and by the way, as I'm reading this, feel free to disagree. When we will come back to you and get all of your critiques and all of your concerns. But contemporary existential psychotherapy certainly does seek to unflinchingly confront the ultimate concerns and frequently tragic existential facts of life, such as suffering, meaninglessness, loss, evil, disease, and death. However, rather than being morose, esoteric, and overly intellectualized, contemporary existential therapy is an exceedingly supportive, pragmatic, in practice, concrete, experiential, and positive treatment approach. It does not deny or minimize the often heartbreaking, calamitous nature of the human condition, but is a realistically hopeful, holistic, and fundamentally humanistic method of treatment. Here in the chapter you see there's a photograph of Rollo May. I'm a former pupil of Rollo May's, so a lot of his work informs mine. Most essentially, existential psychotherapy recognizes the inherent human potential for both good and evil. The potential for both good and evil. The freedom to choose, and Emmy was just talking about this in detail, the freedom to choose who and how to be within the given limitations of fate, fate being the things that, the givens of life, the things that we have no control over. Between the given limitations of fate and our responsibility for these choices, as well as the innate need for meaning and purpose. Now this comes from Viktor Frankl, of course, his emphasis on what he called the will to meaning. This need, this basic human need for meaning and a sense of purpose. And what happens, and I'm sure Alfred will speak to this, what happens is when we lose our sense of purpose and sense of meaning in life, we become ill, we become symptomatic, we become depressed, we develop psychiatric or psychological kinds of problems. The ultimate goal of contemporary existential therapy is not merely to ameliorate painful psychiatric symptoms such as anxiety and depression, though certainly that we address this in practice, we must. The anxiety and depression are the two most frequent complaints of people who seek psychotherapy. So an existential therapist must address these issues. And it's not just to modify problematic cognitions, as in CBT, and behavior, as in behavior therapy, but also to help patients accept, assert, and creatively express themselves in life, to find and fulfill what I call their destiny. And we can talk some more about that. Finally, just to finish up this definition, core philosophical and theoretical concepts, significant differences notwithstanding, contemporary existential therapists share a similar, if not singular, worldview, Weltanschauung. A particular way of thinking about psychopathology and psychotherapy that unifies and distinguishes them from most other clinicians. Central to this shared existential perspective is an agreement that among the universal and ultimate concerns and challenges of life are, and we saw Dr. Yalom last night, this is his sort of summary, are freedom, mortality, meaninglessness, and isolation. A sudden or unexpected confrontation with any one of these concerns can precipitate an existential crisis, which is a frequent cause for people coming in and seeking counseling or therapy.